Hello. Thank you for joining me tonight for the one-sided interview. This is a special report. Pigs. In this report, I'm going to discuss pigs and the swine flu. I'm really not giving you any information that can't be found on the Center for Disease Control. However, I want to discuss this with you because many of you don't have a website or a way to get online, or many do and just don't have time to look this up. So if you don't have time to look this up, sit down and listen to this. The swine flu virus infection is in pigs. It's a type A influenza virus. It has a major impact on the swine industry, particularly in the United States. There are lots of flu outbreaks in pigs, especially during the flu season. And some of the swine flu in pigs may include the signs of coughing, barking-like sound, a discharge from the nose, sneezing, breathing difficulties, going off their feed. Pigs often have high fevers, and that can result in reduced fertility or abortion rates that go higher. 30 to 50% of the commercial United States swine have been infected with swine flu. Pigs usually get the viruses from other pigs. They contaminate one another, but also from birds, like the birds that have avian flu. Also, if a person has the flu, say a farmer or a farmer's daughter has the flu, and she goes out to work with the pigs, or he does, then he could spread his flu symptoms to the pigs, and they could get the flu. The subtypes and strains are complicated in the United States. The vaccine programs that exist have helped to increase the loss and the economic loss in pigs. Nevertheless, it's not something that has been contained yet. There's still insufficient data. Swine flu viruses spread mostly through close contact among pigs, and possibly from human to humans, but mostly, from human to pig, but mostly from contaminated objects moving between them. So a pig gets sick and vomits or coughs up something on a bucket, and then the farmer picks up the bucket and moves the bucket while it's still contaminated, and it's around the other pigs. So the other pigs go over there and pick it up and get the disease. There are possible ways to prevent infection in pigs. It's possible to vaccinate the herds. It's necessary to use biosecurity measures. It's necessary to encourage good hygiene practices amongst workers. Here, the hand washing is vitally important, and using proper ventilation systems. There are flu vaccines for pigs, but they're not 100% effective. And not only that, but all strains aren't going to be known, so just like any flu vaccine, they might not be effective for that reason. And veterinarians can help to prevent the spread of flu amongst pigs and people and birds through developing management strategies. You can eat pork if you want to eat pork. Pork isn't going to be contaminated with the swine vex or with the swine flu. You can eat it because when you cook it, it kills it anyway. Make sure you wash your hands if you're around animals and avoid contact with ill-appearing animals. If you think that you're sick or your family's sick, call your doctor. Go see your doctor. If you do need to go and see your doctor, there are lots of things that your doctor will know how to do right away. That's why it's really important to make sure that if you have problems, you go to see your doctor. A clinician can swab the area and ascertain whether or not there is febrile respiratory illness or not. The patients will be tested for influenza, and specimens for influenza will be sent to public health laboratories for further characterization. If the swine influenza is suspected in humans, a nasopharyngeal swab from the patient must be taken, and the swab will be placed in a viral transport medium, refrigerated, and then sent to the public laboratory. So these are some of the information articles and information, facts, and data that you need to know. There are many. You can keep in contact and keep apprised through checking in with the CDC website. You may contact the CDC if you have questions, or call your state or local health officials to find out more information. Remember, it's most important to stay healthy and avoid people who are sick. Avoid being around animals. If you're not on a farm, there wouldn't be any reason to go to a farm now and get involved in farming. If you don't have pigs, wouldn't be the best time to get involved in farming pigs, unless you're going to be very careful and work with the government and the veterinarians. Those who do have pigs really need to examine their cleanliness standards. Thank you for taking time.